Now, we had a little fun with Polar Bear in the introduction, but now we're going to get very serious about Amberlynn Reid's ER visits this year, and some comments on her health and etc. ad nauseum. We'll see how it goes. And actually, I have made multiple attempts to film this video, and I ended up doing a very short 2.5 minute video as an introduction. I had one finished last night, and when I was going through it, had it all put together, there were a couple things that I think I had gotten wrong, so I thought, well, I'm going to go to the library today and double check a couple of videos online. And I'm glad I did, because it's changed the whole direction of how this video is going. So, say hi, Polar Bear. Hi, I'm Polar Bear, and I've been to the ER 3 times this year. Now, my first visit this year was towards the end of March, and we'd had friends over that day, and we had a lot of fun playing games and eating yum 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 yum. And when they left, I decided, I should say, I'd been having some back pain for a little while, and I have back pain all the time because I'm so fat and plump. But this was different, and I was afraid I had a kidney problem. So after my friends left, I decided, since it was midnight, it was time to go to the ER. So we went, and they drew blood, and they made me pee in a cup, and I stuck my tongue out at that, because that's just the way I am. I don't like that. And they said I had a urinary tract infection, and I got that because I wasn't peeing enough and not drinking enough from my coldest water bottle. And as a bonus, I got a lymphedema diagnosis. Now, this is the video I'm really glad I went back and watched, because in this video about her visit for the UTI, she had mentioned that she almost questioned the doctor, or thought about questioning the doctor to make sure it wasn't a kidney problem, because when she had been to the ER multiple times for when she was diagnosed with gallstones after when she was losing that 89 pounds, it made me realize that Amberlynn Reid has probably always used the emergency room as her primary care physician, or about 80% of the time. And that just strains ER resources, and that's not what ERs are for. And she had said she'd had this pain for a little while that ended up being the urinary tract infection. And the video didn't say what day of the week it was, so it might have been a Friday night, Saturday morning thing when she went to the ER. But if she'd been having this pain, and she didn't say for how long, maybe a couple of days, she should have already made an appointment to go to her doctor. But there's a lot of people that won't do that if they don't have insurance, because you've got to, most doctor's offices you have to pay at the time of service. Now, my second ER visit was just a couple of days ago, and I was having pain near my umbilicus, which is my belly button, and it was a little hard and swollen, and it hurt some, and I had it all day, and then I was up all night, only got 4 hours of sleep because I was in so much pain. So I go into the ER on a Saturday because my doctor wasn't open. And they drew blood and they ran a urine screen and they didn't find anything, and the doctor was so nonchalant and blew me off and said if it gets worse, come back. Otherwise, follow up at my doctor. Now, I think this was a case where Amberlynn Reid was kind of miffed that she got blown off, or thought she got blown off, because the doctor was so nonchalant and basically said there's nothing wrong. Now, let me say, with severe abdominal pain, patients will exhibit what's called guarding. And during this, your patient's probably going to be in the fetal position. They're going to be holding their arms over their abdominal area. The abdominal muscles will be really stiff and they'll probably be moaning, oh, hurt, 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 hurt. There was an episode of Hell's Kitchen where one of the contestants was passing a kidney stone, and he's in the hallway experiencing or exhibiting guarding, and one of the other contestants kind of blew him off, and then later on he passed the stone. And kidney stones are not very big generally, but they're spiky and they're really painful, especially for men. So yeah, I don't think she was experiencing anything super major at the time, and probably not organ related. But she had also, before she went, self-diagnosed herself as probably having a hernia, and saying, well, if it's a hernia, I'm going to have surgery, and I can't have surgery because I'm too fat to have surgery. And honestly, I think Amberlynn Reid is afraid of any type of surgery, but that will probably get covered more in another video. It's the day after my second ER visit, and I wasn't happy with them because they blew me off. And now I'm bleeding from my umbilicus, and this is a true emergency, and I'm going to the ER again, and I'm going to get a real diagnosis because those other people just blew me off. Now, if this had been, severe bleeding from her umbilicus, which is your belly button, I can't imagine Amberlynn Reid or anybody else jumping in front of the camera and saying, oh, they blew me off, so I'm going to the ER again. Maybe film yourself afterwards, since, everybody's got their phones with them and those have cameras on them. So I don't think that was serious. The fact that there was nothing on Snapchat or Twitter about her being admitted to the hospital tells me that it probably wasn't serious. And Basically, hospitals will not admit you unless your treatment is going to take more than 24 hours. I mean, you can have appendicitis surgery and they actually won't admit you. They'll do the surgery, you'll spend a couple hours in the recovery room, and they'll send you home to recover from there. Used to be an appendicitis surgery was probably 3 or 4 days in the hospital, but that's not the way hospitals work anymore. So this bleeding could have been from a rash. It could have been she had a bug bite and had scratched it in the middle of the night. There were a lot of people commenting on this third visit that she's probably had a rash or a yeast infection in this area because of improper hygiene, because, you know, the fat folds are skin on skin, they're sweating in there. It's a aerobic environment, which means without oxygen. But still, the fact that she's gone to the ER 3 times in 2 months, she complained of pain in her left thigh. I think it was her left thigh. And she gave us 3 different diagnoses for that. One, she said that she had been diagnosed with lymphedema at the ER during the UTI visit. She also said that she had gone to her regular doctor and she had said it was lack of circulation. And there was a third reason that Amberlynn gave, but I don't remember that. We haven't heard about it since shortly after the UTI visit, so we're not sure what was up with that. But basically, unless you're going in for multiple trauma, the emergency department is focused on what brought you in there, and they're not going to be looking to diagnose you with other stuff. Basically, they want to take care of the emergent problem and either admit you or send you home to go see your regular doctor for further tests and such. So I seriously doubt she was diagnosed with lymphedema at the ER. She had also self-diagnosed herself with lymphedema because she said she found it in her abdominal area. Again, lymphedema is not something you can just self-diagnose. So anyway, the fact that she's had a urinary tract infection, some sort of abdominal pain, leg pain, this bleeding from her umbilicus, which I think was not a separate issue from the abdominal pain visit. She's had this wound on her arm for several months that hasn't healed, and she said that's just because she keeps picking and scratching at it. I've always, especially when I was a kid, tended to pick my wounds and scars, and I never had them last for 6 months, maybe a couple of weeks, but you got to be working pretty hard at it to keep those open. So I don't believe that. And the conclusion is Amberlynn Reid, she's 28 years old. She's had multiple, mostly minor from what we can tell, health issues this year. And that's just not normal. You know, when I was in my 20s, I might get a really severe cold every couple of years. I think God, yeah, I don't even think I had my first serious, put me in flat on my bed for days illness until I was in my early 30s, and I caught something. It was during the OJ trial. Totally beside the point, but you know, not normal for somebody in their 20s, especially not one in an environment where you would expect them to be exposed to lots of illnesses. So she needs, you know, these things are minor, but they're adding up to something bigger. And I think she's starting to see the repercussions of being 570 pounds, almost 600 pounds. And she needs to internalize right now, even though she knows intellectually that she needs to stop gaining weight. You know, stabilizing her weight would be a great first start, and slowly start losing it. And she's afraid to do that because her identity is as a fat person. And I'm afraid if she really doesn't get serious really soon, she's going to be dead by the time she's 40. And that seems like a long time away when you're 28 years old, but before then she's going to have more health issues. She's going to end up bedbound. It's going to be ugly. Now, she does seem to be on this healthcare kick right now. She said she's been to a mental health clinic, that she's been to the dentist, the weight loss doctor, although she did say she disagreed with what the weight loss doctor said. So I'm thinking that the medical weight loss program out the window. And as her videos have been about 6 weeks old lately, my guess is she's already gotten off this health kick and is probably already filmed a real super mukbang by now that we'll be seeing before too much longer. And it's a real shame because I want to see her succeed and lose weight, but instead of taking these little health issues as a warning that things are really starting to happen, I think she's going to view them as acute short-term issues, and once they're solved, she's going to go back to her old ways. So say goodbye, polar bear. Goodbye!